Yes, it is a very friendly town, Corby. We live in a remote area. Distance is a big thing. We do have a few elderly clients here and they don't like to travel. Some of them aren't well. A lot of people don't know much about the city as well. That's really hard for bush people, I think, and especially Aboriginal people.
The Quilpie Township, approximately 550 people live here. We have a great community, good community spirit. We can't have every service here because it's obviously not financially applicable.
CheckUP's a not-for-profit health organisation. We're committed to creating healthier communities and reducing health inequities. And we do that by coordinating a wide range of health services which are delivered in rural and remote Queensland.
The outreach program is making services that normally are out of reach for a lot of the families that won't have the funds to travel or are too unwell to travel or are unlikely to travel because they've got other barriers. The outreach program has removed a lot of those barriers for families.
It's good to have them here. If we have to travel to Rome, that's 3 hours away and that's 6 hours out of your day. If we can keep the services here, then it's better for us, I say.
We know that our remote and rural Australians suffer poorer health outcomes than those that live in cities. Our remote Australians deserve good health care. There's no reason that when the country needs them to be in the remote areas to put food on our plate and to keep the country going, that they should have to suffer less access to health care because of it.
We have about 120 referrals that we're working with at the moment, so pretty busy time for those specialists that visit here. We have a lot of helplines and all that sort of stuff which are good, but having that face-to-face it's like gold to these people in the bush.
When a patient knows that there's a doctor, a nurse, a pharmacist, a physio that's actually committed in a long-term sense to providing care in that community, it's like a sense of relief for them because they know that they're not going to have to repeat their story. They know that that particular person's invested in them and the community, and it means that they're going to get better health care.
For the last 11 years I've worked as a podiatrist and been providing outreach services to Quatsics in Charleville, Roma, Mitchell and Quilpie. What I enjoy doing is getting to know people and building a rapport with them.
We have a lot of providers who have been going into these same communities for many years. So they build a rapport with their local community, with the local health service. It's more about building connections with health providers in these rural and remote communities.
I think the CheckUP of supporting us to go to locations wasn't just about us providing a psych service, it was about building the capacity of those communities, and we found that was in professional development, workforce enhancement, self-care.
When we are looking at providers, we offer them support in collaborating with them, linking them in with other providers, linking them in with our host facilities. We offer them training. It's really important because we need to support them so they do stay with us long term.
By getting to know people better as a regular clinician allows you to better understand the needs that the individual may have to help them get the best health outcomes that they can.
Really, it's about continuity. And this is where CheckUP is incredible, is that the service needs to be ongoing for the community to form that bond and trust with the clinicians and feel comfortable coming and talking to us about really sensitive topics.
Born and bred in Winton, Queensland, and with driving trucks I got the pleasure of coming to Charleville about 1986. I had a bit of a mental problem there 18 months ago, and it wasn't no fault anybody. Ed, he was just unbelievable. Very caring bloke. We are blessed out here in the West to have people like that.
When we see the difference that these health services make to people's lives, That's incredibly rewarding. It's extremely satisfying. We know we're doing a job that does make a real difference in people's lives.